You ever seen a fat transfer?
No, I haven't.
Okay, so when they take fat, they liposuction it out, okay? And then they stick it back and you put it in your face or something like that. The problem is you can't control how it's going to grow in your face. So if you do a fat transfer in your face, you're like, because some's going to live, some's going to die, but you're going to get all these stem cells and your tissue's going to look pretty freaking good. You're just going to get this really nice picture, but it might not be symmetrical.
Yeah.
That's why liposuction and when they do Brazilian butt lifts and stuff like that, don't always look perfect.
And I was at a spa night, not too far from here, and honest to God, I sat behind these two girls and I was going,
Huge.
28-inch waists and 48-inch hips, and I was just like, they did that on purpose, because I have never seen a natural butt look like that.
Yeah, they're very, those are unlike
A Brazilian butt lift, is that what it's called?
they call Brazilian butt lift, yeah.
Oh my gosh.
A BB, yeah.
They had the false eye. I'm not making fun of them, and I'm not saying they were ugly, but they looked like a cartoon caricature.
Maybe too low exaggerated.
They were. They had the false eyelashes, they had the bodacious, buxom, and then they had these.
Yeah, it's over the top now, huh?
Totally.
It's over the top, It's like it's, well, but if they could have done this stuff 50 years, they would have been done then too, you know what I mean? But, if you got it, they'll take it. But, I'm amazed at the stuff I see today, but when they do because when they're doing liposuction, remember they're doing a fat transfer, right? What's your fat full of? Mesenchymal stem cells, right? And tons of growth factors, so we just transfer that stuff and woke them up.
Oh, and now they're gonna go.
Right, so now they're gonna increase blood supply and they're gonna grow. They're gonna, it's part of the process. And so that tissue, so they do it, they stuff it in there, and then what happens is that it gets a little bigger over time too. It increases blood flow and can get really firm. So they get that's the whole point. You hope for the best. So when they look at this, they measure out. They want to make sure they give, the symmetrical amount and hope for the best that the fat will take. And most of the time, it does take well because you have a lot of capillary beds, and fat is really good for diffusion of nutrients and stuff. But on occasion, someone's going to die. It's not going to look right. But they just look like they missed a little bit on her buttocks.
Wow.
Yeah, but people used to do that to the face all the time. They stopped doing it because they get a little bit asymmetric, You can't, the face is very...
I saw somebody with, she had to have had cheek implants, and at some point in time, they shifted, and you could really tell. I mean...
You know what they did? They did permanent implants using Actigol or some kind of weird stuff, and stuff that we don't really use in America, because when you put permanent implants, what do you think you have to do later on?
You're going to have to lift them or something.
You got to take them out.
Oh, take them out.
You got to take them out because they're not going to be, because what happens? We have gravity we deal with every day, right?
Yeah.
And tissue integrity. So the tissue strength is not the same, wear and tear.
Yeah.
And on top of it, gravity pulls on every day. That's when women ask me, what can I do with my face, Mom? You know those face things you push up on your face and you go to bed, get one of those. Wear it every night. That way you get 8 hours of lift. Does that make sense?
Yeah,
it's
it does.
Funny.
It does.
And then do and then do infrared and red light therapy and do erbium laser and do some plasma lift. So you just get stimulus there on a regular basis. You're stimulating the growth and the healing repair. So that's the only way you maintain the integrity. It's just hard.
Yeah.
It's a battle.
At some point in time, we just have to roll gracefully.
You know what people do too? Let me tell you something else. You know how sometimes boobs are off a little bit, or you want to get a little bit bigger, and they don't want to do a boob job. We used to take tons of PRP and inject the boobs too, and you can actually get some boob growth. How about that, right? Because you get stem cells. Remember, there's stem cells in your blood. Not a lot, but there's some. And you got a ton of growth factors too. Obviously, it's going to work better for the younger you are because the response is greater, right?
Mm-hmm.
But you can actually see some tissue growth. I go lectures all the time, man. They show huge difference. But they're transferring fat, and they're also transferring a lot of platelet plasma too. Today I did a non-surgical lift on a gal. She came in and we did 3 syringes of a hyaluronic acid product, some Versa and some Juvederm in her face for her cheeks, and then because she was a little bit on nasolabial folds were pretty profoundly deep, so I filled them and brought them up a little bit. Then I kind of evened it out as we went down. And then she had a little bit of pre-jawls she sunk in, so I filled them out. And I filled in along because she had the upside down smile thing going on. So I filled really good on both sides here, and it made her chin a little bit longer by filling the distal portion of it. And then I Botoxed her. And actually, I actually threw her in the infrared and red light therapy, but right after the treatment for 30 minutes too, to give her additional stimulus. I think she's freaking great for I was actually surprised of how good she looked. I was like, yeah, it's gonna look really good, you know, because usually you see the results over like, you know, like a few weeks and stuff, and they hydrate more and it kind of swells up a little more because that's what happen. It has to happen. You gotta get, you know, the fluid to get in there. But I was like amazed how good she looked. Like when she left, I was like, whoa. I'm like, you could. I was surprised. I surprised myself.